So many waited so long for this. Toronto locked down longer than anywhere else in North America. But this won't last. According to a growing number of physicians, more lockdowns, they say, are coming. A yo-yoing of openings and closings they believe could have been avoided.
What were you telling government?
That they needed to be very careful about pulling back measures.
Dr. Gerald Evans has prepared Ontario for infectious diseases for 3 decades. Part of the science table advising the country's most populous province about its winter lockdown.
You would have kept that lockdown.
Absolutely. If we had maintained those for a few weeks longer, I think the number of cases would have dropped so low that the impact of the variants would have been a lot less than what we're seeing now with this third wave.
Dr. Evans' point is that Ontario, now hovering above 2,000 cases a day, should never have loosened restrictions until that count was below 150. He says it would have taken 3 or 4 more weeks in the winter lockdown and made virus resurgence much harder, and another lockdown unnecessary. Striving for near zero before reopening has been the policy in Atlantic Canada, and for the most part, it's worked.
I rely on health and science. That's number one.
But Doug Ford also needs to listen to business, to employers, and they've wanted to reopen to customers.
And we've constantly been trying to balance the two, and the result of that is that we've done neither successfully.
And epidemiologist Ashley Chute says the result is plain to see. Businesses now likely facing another lockdown soon, as new cases, variants especially, surge. Hospitalizations already critical.
Where are we heading?
I think we're going to be in for a rough 2 months.
Yes, vaccines are being doled out at a much faster rate, but the virus is even faster. The variant's more contagious, more deadly too, particularly now, says Dr. Evans, to those around their 50s.
Had the government kept things locked down for just 2 or 3 or 4 more weeks, would fewer people be dying this spring?
It's a bit speculative, but yes, I would say so.
Lockdowns have never targeted warehouses. They're deemed essential. In Ontario, multiple large outbreaks have happened in places like this, and if COVID is floating around the community, it's surely to spread in these tight quarters with high demands, says this workers' advocate.
Which leaves them with little to no choice than to push themselves harder and ignore those safety protocols that might be in place for them to follow.
None of it is easy, of course, but this is a marathon. And while the finish line may be in sight, the final mile may be the toughest. David Common, CBC News, Toronto.